us? How do we talk about our purpose in this space? How do we move together as a collective? So there's work that's being done. We have providers, like as Pascal said, let's connect to those providers who understand what it is to lean in into those principles, those strengths that we have, and uplift us as Black people, as Brown people, as Indigenous people who really want to do this work. We're not just, we don't live in our head. We are spiritual beings with our souls. They need to touch our soul, because this is about saving the souls of Black people. It's not about the mind, only it's not about taking them in. It's deeper than that. And until we connect with providers who understand that this is about our soul, for our brothers and sisters and our own soul, it's going to be a challenge. And there are people out there who are doing this work. Don't get discouraged. We are out there. We want to do it the right way. We see you bringing in that racial pride, bringing in those principles, and weave it into the clinical work, finding ways for our people to talk about mental health. How do we find those hip hop lyrics? Yes, there's balancing, but that's what our youth connect to. How do we use that to help them talk about their pain, the non-traditional way of addressing our pain? I don't have to sit on someone's couch for 45 minutes to talk about what's happened. There's different ways to do that. And as parents, we need to begin normalizing our pain, our need to get support, model that for our children, encourage, continue to have this discussion that it's okay to feel pain. It's okay to feel what we're feeling. What do we do about it? You have a village with you. You are not alone. You're people of interdependency. I'm not okay if my sister's not okay. I'm okay only if my sister's okay, and weaving that in. So this network, thank you for doing that. Thank you for bringing us together. And we have to keep pushing forward and demand that you see us before you begin treating us. If you don't see me, you cannot treat me. So thank you, everyone, and blessings, peace and blessings.
Thank you so much, Pascal and Dr. Najat. I love it. I love it. I love it. If you don't see us, don't try to treat us. I love it. So we are really excited to move forward. We thank again all of our partners that are with us and that have been with us. We are ready to get ready for our panel and bring forth our panel moderators, hailing from Buffalo, New York and Rochester, New York. We are so excited. We have a power-packed panel. All of our panelists know their time frames and their questions. And again, we're going to ask you to use the Q&A tool for questions. The Q&A tool is not meant for comments or to put your contact information. It's meant if you have a brief question, we will want to get to it if we can, okay? So at this time, I'm going to turn it over to Jarrell Mason and Daphne Brown. Jarrell Mason is from Best Self Behavioral Health and has brought a new, fresh energy to outreach and engagement. And of course, Daphne Brown is all around the state, all around the country with an amazing family advocacy organization doing some amazing work in the space of child protective services, children and family, and mental health. So at this time, I'm going to turn it over first to Jarrell, and then we're going to turn it over to Daphne, who will kick it off with our panel experts.
Hi, good morning, everyone. My name is Jarrell Mason, and I am the Director of Community Engagement at Best Self Behavioral Health. Best Self is the largest community-based organization within West New York that provides outpatient treatment services for mental health and substance use. And a large part of my role is diversity, equity, inclusion, racial equity and inclusion, as well as working within the BIPOC community. So it's very nice to meet you all this morning.
Good morning, I'm Daphne Brown. I'm with Families Together in New York State, and we're a statewide family-run organization. Our goal is to make sure that parents, families, and youth have what they need at the local level to get their service needs met. We advocate at the state level with commissioners and legislators to make sure that the money trickles down to communities and that they are really getting the services and supports that they need. Our motto is nothing about us without us. We believe that families and youth should be at the table when they're making decisions about us. So we make sure that we are sitting on committees where they can hear our experiences and the services that we need most for our families and our youth. With that, I think we're going to turn it over. I think we're going to start the discussion. So our first panelist is Lakia Wilson, Dr. Lakia Wilson. Good morning. So Dr. Wilson is a Rochester native pediatrician and adolescent medicine specialist with Rochester Regional Health. She serves as the medical director for 2 youth detention centers, Industry School and Monroe County Children's Center in Rush, New York. She also serves as the medical director of Rochester Regional Health, 5 school-based health centers in the city of Rochester. Welcome and good morning, Dr. Wilson. Are you ready for your first question?
Yes, I am. Good morning.
Good morning. So, as a pediatrician who has prioritized addressing the social and emotional health of our children living in poverty, what have you seen over the last 20 months related to the heightened levels of mental health symptoms? And what are some strategies that you and the Rochester Regional team have implemented to address these needs within the Black community?
Thank you, Daphne. That is a very thought-provoking question. And I can actually spend hours upon hours addressing this, but I'm going to keep it real. Our children are not okay. And this is from the mouths of our babies. Our parents, our caregivers, the families, the community, they are not okay. The anxiety, the fear, the trauma, just being overwhelmed is palpable when I walk into that exam room. This is my impression of my patients that I'm caring for in the office. And I scratch my head and I wonder about my families that I've lost touch, that are home in isolation and not reaching out. So I think initially for like myself as an individual, what am I doing, right? How am I addressing this? And I have a special place in my heart for behavioral health, mental health. And I started my career saying that I wanted to work in the community and I wanted to be known as that person that people could come to for help. And during this pandemic, the 2 pandemics, we're dealing with COVID-19 and all this racial unrest, I awoke. I said, I need to do more. I'm where all the kids are at. I'm in the schools, I'm in the clinics, I'm in the jails, I'm everywhere, but that was not enough. So something inside me woke up and said, I needed to do more. I needed to be at every single table that had to do with our community, our people, whether it was with behavioral health, just primary health. I've done it. I've gone on these tables. I'm making connections through the community. I'm making sure our voices are elevated, they're heard, and actions are starting. Change needs to start now and continue. So what is my hospital system doing, Rochester Regional? So we are continuing to survey our families, looking at the social determinants of health, and we do this through the ACE questionnaire, which is Adverse Childhood Events. The data is collected, and we have resources for our families to address major components of the ACE questionnaire. What we are seeing, because I've learned that even though I'm passionate about this, we need that data to make change. And so our hospital system is collecting that data. So the concerns are housing, transportation, employment, daycare, and mental health, which is not a surprise to us because we've been voicing this, that these are our concerns for such time. Our medical team has been partnering with our behavioral health team because we know that we are the first point of contact, especially when our kids weren't in school. How do we get our families into mental health needs if they need that? We have created resources and handouts on the pediatric level for our families. And we've also helped educate our providers on what they can do in the office. Our behavioral health specialists have participated in cultural responsive training with BIPOC Peak. And we've been working to increase our workforce. Our therapists that are embedded in the schools, we have gone up to about 60 sites so that we're making sure that we are meeting our families where they're at. As a system, we are making it our goal, our priority to hire and retain providers of color. Our behavioral health services continue to have open access on Mondays, Wednesdays, and Fridays from 8:30 to 10:30. Our behavioral health crisis center on the St. Mary's campus continues to serve our families throughout the week, every day from 9 to 9, and walk-ins are welcomed. We as a system are increasing our telemedicine services to improve access to care. We are intentionally partnering with our community to elevate the voice of our parents and the community to provide appropriate care through an anti-racist, racial equitable lens, and that we are examining our current policies and practices and seeing what we need to change. We are invested in educating and training our providers so that we can address these disparities in care.
Thank you. Everything you're doing sounds great, and I hope that our parents will utilize it. Getting the word out there is so important because, you know, a lot of times our parents are not seeking help. So thank you for your response to that question. I'm going to turn it over to Jarrell.
Thank you. So next up, we're going to throw in the hot seat Pastor Dan Butler. Pastor Dan Butler is a bivocational pastor with a demonstrated history working in the not-for-profit organization management industry with experience in crisis resolution, facilitation, as well as currently serves as the director of advocacy and education at a local not-for-profit. And so for you, Pastor, I would ask, as a pastor outside of praying, what have you done personally or have you seen done to address the loss, grief, and trauma within your own congregation or other congregations?
Let me unmute and let me get this tech right first. First of all, as you can see, I am the director for equity and advocacy for the Urban League of Rochester. So we work in the DEI space of racial equity. So we understand that we're in the midst of white supremacist or white dominant culture. For me as a pastor, first of all, with my assignment, I must be sensitive to what the Lord has for me to do and understand the work that he has given me. And so for my particular assignment in the kingdom, I have an older church. Just about everyone is a senior citizen or retired. So that brings its own challenges because I found with older believers is that they like to hear from their pastor. And so the pandemic has made that challenging because they're not as tech savvy. So for us to keep everyone informed and to feel a part of what's going on is that we've sent out emails, old snail mail. We try to keep them informed, even with a newsletter that we try to do because everyone is being affected by COVID-19. So in the midst of that, dealing with grief, because I've had several members that have lost family members to COVID-19. I lost my mother in 2020 during the pandemic. And so that had its own challenges. In 2020 was before the vaccines. And so we've had to be creative and also innovative at the same time in order to be effective. And I believe as a pastor, we're all been challenged in these areas. And I think the most important thing is to understand the people that the Lord has put in your charge. And to understand that if you need outside help, to tap into that. That is so important. And so dealing with the trauma and the grief and the loss, I've also let them know that I myself have a therapist. And that you have to reach out and understand that there is help in the community if you know how to reach out to that. Because I found out that in the Black community, they expect the pastor not to be the jack of all trades, but the master of all trades. And I found that puts us on a pedestal that really can get us in trouble. So I found for us, it's important, again, I'll emphasize, understand the assignment that you have. And understand the people in your charge, and then you're able to navigate in this particular climate that we're in, because it is a charged climate. It's as if part of our society is on fire. And so being sensitive to that and also skillful and being able to use the tools at our disposal helps us to be effective in handling the different congregations that we have, because dealing with a baby boomer is different from dealing with someone that's a Generation Z in this climate. As the doctor talked about, our children are in trouble. And so I have single mothers with children. So I particularly pull them to the side, and I do take extra care to ask them if they need any help. For me, being in the community, I have learned how to network and to connect the dots so that I can push them where they need to be, and even do referrals if I have to. I know that may be part of my second question, but I just wanted to share that.
Well, thank you so much. I think it's very important that you mentioned as the leader that you also seek services, which shows the lay members that it's okay. I'll pass it back to my co-moderator to keep the conversation going. Thank you.
So our next question is for Cynthia Adele. Good morning. How are you?
Good morning. I'm well. Thank you for having me.
Thank you for being with us. Cynthia is the CEO and founder of Rochester Health Engagement Partners, which is a not-for-profit organization that empowers the African American community to live healthier by giving them the tools that they need. She has more than 20 years of experience in the areas of community building, education, and outreach, working with underserved populations. So my question to you, Cynthia, is talking to your doctor and those in power can be intimidating. How can parents and caregivers prepare themselves for difficult conversations with providers?
Well, this is a question that I recently had to deal with. I had to see a specialist last Friday, and it was my first appointment with them. And I had to previously change from my other specialist because they weren't sharing information with me. I literally was on the bed waiting to be put under before they shared some devastating news with me regarding my health. And that let me know I have to leave this practice and go to a different one that's going to be totally open and honest with my diagnosis. So Friday was my first appointment with this specialist. I went in thinking, wow, I'm going to get all my answers. I've been having a very, very bad cough, and I was attributing it to my diagnosis. So when the doctor came into the patient room, he may have spent all of 5 minutes with me. He did not address my concerns. When I told him about the coughing, he said, well, I don't know what to tell you. He really said that. I could not believe it. So after he left out, I spoke to the nurse practitioner, and I told her, I said, you know what? If I was a person who was easily intimidated, I would leave here fearful right now, because I came in worse than, I'm leaving worse than I came in. The doctor's telling me he doesn't know what's wrong with me and not trying to give a treatment plan as far as to even explore it. So I have a list of things for people when they go to doctor's appointments and may have difficult professionals that they have to deal with. These are some of the things you can do. First, you should be proactive and come prepared. Come in with a positive attitude. If the other doctor rubbed you the wrong way and you don't trust them, or you feel the doctor's just not listening to you, start that new appointment off in a positive light. Come with a goal or an agenda in mind and introduce that at the beginning of the meeting. Usually they'll take charge, but if you're proactive and prepared, you can come in and you can introduce what you want to discuss. You can run the conversation. May not be able to run the entire conversation, but you can get it started. So bring notes regarding the topics that you need answers to or want to discuss, such as, are there any side effects to the medicines you've been taking? Have you been feeling bloated? Is it making you dizzy? Do you feel slightly off? Is it affecting your driving? Let them know if you're feeling depressed or experiencing any mood changes. Have you lost any weight? Have you gained weight? Has your appetite decreased? Those are some of the things that you want to share with your doctor. Definitely ask your doctor, what is the treatment plan? And how will it affect your daily life and future health. Let them know if you disagree with that treatment plan and ask them what are the other alternatives. Every treatment plan is not for every person. Just remember that you are an individual and what might work for some may not work for others. And if you're experiencing any side effects or mood changes, obviously something needs to be tweaked. Sometimes people are afraid or hesitant to ask questions. Ask your doctor to clarify what they mean if you don't understand it, if he's putting it in medical jargon. You could say, could you please rephrase that? I didn't quite understand what you meant. Can you explain it in another way? They are there to serve you. You are to get answers for any questions that you have. Don't feel as though you're bothering the doctor, because in the long run, it's going to help your care. And if you don't listen to what they have to say, your condition will become worse. So you definitely want to get a clear idea of what they are telling you to do. So repeat back what the doctor said to you for clarification and also for you to absorb it. If you can't remember things that well, record the appointment. We all have phones now. You can turn your phone on and record the entire conversation. Sometimes, such as in my case, sometimes when you are given a serious diagnosis, things fly over your head. You don't necessarily digest what the doctor just told you. And if you don't have a source of a way of recording it, bring someone with you. So
Thank you, Cynthia. Those are great tips that you're giving to people seeking services, for people who are there to support us in our treatment options. Yes. Thank you.
You're welcome.
I'm going to turn it back to the moderator, Jarrell.
Thank you. So next we have William Cannon. And I want to make sure I have your bio exactly right, because folks work hard for their credentials. Mr. William Cannon is a licensed mental health senior therapist in Rochester, New York, and has experience in addiction counseling, relationship, marriage counseling, and is a certified family therapist. He's also served as an adjunct professor. He has a passion for advocating for those in our community, particularly those that are marginalized. So the question that I would have for you is, as a Black male clinician, what are two of the major challenges that you've seen as it pertains to reaching out to Black children and adults and engaging them in treatment and care?
Thank you. Thank you once again for that great introduction, invite, and what a great forum and great question. One of the important internal challenges that I see is a lack of representation. I'm currently the only Black male of 22 therapists working in my department. So one of the major barriers that I've seen personally and experienced is that when African-American men apply for a job in the field, many times it takes more interviews and more experience to get the same job that Caucasian counterparts are given right out of school, often with no experience. So when that happens, there are fewer African-American clinicians in the field, even though they're qualified to do the work. Now, upon my graduation from college, I applied for several jobs and was one of the final candidates several times. I ended up not receiving these positions for what I was told. What was relayed to me was a lack of experience. Later on, due to my connections, thankfully these organizations, I found out these jobs were given to my Caucasian counterparts, qualified, but who also, like myself, had no experience. I ended up having to take a job outside of Monroe County for several years due to this upon graduation. Now, where this becomes an issue is engagement with the Black demographic, as people are more likely to engage in mental health treatment when they're talking to someone who they feel they can relate to, understands their cultural, their values, and their norms. And another internal challenge I see is that African-American families are not a demographic that is focused on with a distinct therapeutic approach for the distinct needs that are required. I firmly believe that that a therapeutic model should be put together by African-American clinicians initially, as who better to know our families and communities than us. Now, from an external standpoint, one of the challenges I see is engaging with African-American families is a continuous work on destigmatizing mental health treatment as something bad, shameful, or embarrassing. And I've got to thank you, Pastor Butler, for the work you're doing, the efforts you're doing, and breaking the stigma by way of personal transparency and literally connecting your congregants to community resources. That's powerful and helping to break this stigma, especially in a position such as yours. Now I've seen my work with Black families that many times these families were only seeing me due to mandation, being mandated by a court system or CPS. This is why it's important for families to seek treatment early and preventative measures early. Knowledge is power, and forums, discussions such as this, very vital, important step in providing the necessary education for the very unique and distinct challenges that our families face.
Wow, thank you so much. And as a Black male, we could talk forever, but we're on a time limit. So I'm gonna pass it back over to my co-moderator, Daphne. Thank you.
Hi, our next panelist is Kelly Dumas. Is Kelly? Good morning, Kelly.
Good morning, Daphne.
How are you?
I'm well.
Okay, good. Kelly is a licensed clinical social worker and has over 18 years of experience working in human services. Kelly is currently employed with Best Self Behavioral Health in Buffalo, New York as the Chief Strategic Initiatives Officer. Kelly oversees the specialty substance use services, community-based treatment services, homeless and housing services, and she leads the racial equity and inclusion work across the organization. So my question to you is, can you talk about the system and organizational accountability for adapting policies and practices through lens of racial equity and moving beyond the check the box and in it for the money mentality?
Yes, thank you, Daphne, for that question. Before I answer it, you got my old bio. I'm the Chief Operating Officer, so I oversee it all. And that's important because part of what I'm going to talk about or in your question is building in accountability. And so oftentimes with these organizations, the way we're situated is it's hard to, a lot of them, they don't have people of color in positions to assist with accountability around these pieces. So I'm fortunate in the seat that I'm in. I've been with Best Self for 10 years and we've been working on these things, and I've been in this role of overseeing it all since October, but I'm able to put some checks and balances in place and bring in positions like a Jarrell, whose job description is focused on racial equity and inclusion and bringing the BIPOC voice into to inform our treatment services and engage our BIPOC communities. So it's important that when you look at accountability, you have to build that in. If you can't have that internally, what I tell organizations is you need to look at maybe contracting, consulting with someone who can come in. You gotta put your money where your mouth is. If you say racial equity and inclusion is important, then you have to be able to spend some money and take some time to focus on that. You bring someone in with that's able to bring in that accountability piece and work with you and your identified internal team, because internally you're gonna have to evoke culture change within your organization. So you build that in and you allow them to work with you for that. Another great place, I'm talking fast, I got like 2 minutes left. Another great way to work in the accountability, I tell most people who are in this space, they've already done some initial work like an organizational assessment, which gave you a lot of feedback in terms of gaps, opportunities to improve your organization in this space. It's important that you share that information. Share. You should have identified where your opportunities to do better are, and then you should have used that information to develop a plan. And when we share, that's no different than any of us who have had goals related around, whether that's losing weight, was a common one many of us do. We hear about accountability partners. The more people who know what your goals are, they can kind of check you on that and keep you in line with them. Wait a minute, y'all said it was about the racial equity and inclusion. You done put it on your website, and that's how you tell your clients, your staff, the community, everyone should know about this important initiative, and they can help keep some accountability measures, because when they see you moving and operating in ways that aren't reflective of that, they can kind of question that. And I encourage parents and families to do that. You have all these companies and agencies that expressed how they value Black lives and it's so important. Well, ask them, if you go in there, and which is often the case with Williams' case being the one Black clinician of so many, where are your Black clinicians, or where are your clinicians of color? Why are there no people of color in power, making decisions, overseeing the treatment? We can do more than empty the trash and clean the floors and cook the food in the facilities. We actually have we have degrees, we have knowledge, and we have value to bring. And so if we don't see us in those positions, I encourage you to challenge that and ask why and demand that. If you want me to come here to get services, to get treatment, I need to see myself reflected at all levels, all the way to the top. I'll stop there.
Thank you. So what I heard you say is, let's be transparent and intentional in what we're doing when we're saying that we are an equitable organization. So thank you. I'm going to turn it back to over to Jarrell.
Thank you so much. And selfishly, like Kelly said, she created my role. So, you know, I'm a little biased in that. And so I know that she's about that work. So thank you for that, Kelly. Next up, we have Calvin Eaton. He's the founder and executive director of 540 West Main, a nonprofit that is one of the region's top leading organizations providing anti-racist education, which we really need in this time and all times. Calvin is passionate about education and learning about history and structural racism in the US and how this history influences and affects present day lived experience. And so the question that I would have for you would be, you've been very open about your own mental health condition. And we know that there's various levels of stigma surrounding that and associated. What can we do as individuals and as organizations and systems to address this stigma?
Thank you for the question. It's a big question. I mean, looking at the individual, institutional, and systemic. But I think that one of the things that we've talked about on the panel and many of the clinicians is we really do need to get comfortable as Black community having candid conversations about mental health and mental illness and mental well-being, emotions. I know that there's conversations around what it means to be a Black man, masculinity, femininity, et cetera. And there is a lot of ancestral trauma, to borrow one of the openers, talking about being vulnerable, being candid, especially, I know I grew up with both of my parents, but I'm in therapy, and I've always felt like my father has not always been as vocal. He's been a provider. I know that he loves me, but hearing that he loves me, him telling me, "I love you, son," is not something that was very natural to him. And we've had those conversations. And so why is that? And how can I not pass that into the world and continue those types of traditions? So I think just overall having conversations about suicide. I talked to Sarah in preparation for today, and thinking about like something like cutting, right? Even that alone is something that you often attach a white person to that. Like, cutting happens in the Black community. Yes, it does. And that's not something that we talk about. So individually, we have to really get comfortable and candid, talking about our emotions and our feelings, looking into systems and institutions. It starts in schools. And we know that the adultification of Black girls is something that is real. There's research happening around Black girls and boys being seen as much more mature and not given the humanity that white youth are given. We've seen countless examples of that in media and situations. Elijah McClain was shot because he was walking down the street. Trayvon Martin, this sense that we see media depictions that Black boys and girls are older, are sexualized, are seen as adults when they're children. It's something that is represented and replicated in our media. So we have to counter that. Institutions, it starts in the school system. We know that the school to prison pipeline is real. I'm going to always champion educating yourselves as clinicians of all races, but especially white clinicians, understanding the adultifying Black youth. And in our school systems, we see that Black youth are not given the same humanity that their white peers are given when they mess up. There's respectability politics. There's this sense that Black youth always have to be perfect, and it's unsustainable. We saw a 9-year-old girl pepper sprayed in Rochester. The police told her to act like an adult, and she's a child going through a mental health crisis. So we really have to move beyond policing in schools. We have to put the funding where we're saying our priorities are. I know Dr. April Aycock is here representing Monroe County. We need more service providers, clinicians in our school systems, and less police officers. Police officers do not reduce, they're a Band-Aid. They do not reduce mental health outcomes in the community, in schools. And we really need to have counselors, social workers, et cetera, in our schools, especially right now during this pandemic. And we need to also make sure that we have more educators of color in schools. There's a lack of Black teachers across the board at all levels. Black men teachers are not represented. And we know what happens when you see teachers in classrooms that look like them. So there's a lot that goes with this. So I'll stop there as well.
So we can go on with this forever. This is why Ms. Taylor puts together the best panels, but for the sake of time, we'll move forward. Thank you so much for that. We'll move forward, Daphne.
Okay, our next panelist is Dr. April Aycock. Good morning, April.
Morning.
Good morning. Dr. Aycock is the director of Monroe County Office of Mental Health, and April has extensive experience providing leadership and community-based clinical services in the areas of substance use and mental health. She has been very firm on her commitment to implementing equitable process and policies that will move the BIPOC community toward healing. She also serves as an adjunct professor at the University of Rochester. Welcome. So my question to you is, having extensive experience within and outside of the Office of Mental Health, where do you see the greatest challenges that can be poised for opportunities as we talk about policies, practices, and providing culturally responsive services to communities of color, and partnering with those who have often been missing at the decision-making and funding tables?
That is a loaded question.
Mm-hmm.
I just want to make it very clear that the challenges of Black mental health has been existing before the pandemic. So I just don't want that to be interpreted. The pandemic is making us focus on it, but we've been dealing with this for years. I'm going to highlight some challenges, also provide some opportunities briefly. According to the National Health Interview Survey in 2020, for adults age 18 and older within the past 12 months, 25% of whites utilize any types of mental health services compared to 15.3% of Blacks. Likewise, for medication, 21% of whites were prescribed and utilizing medication compared to 10, or I rounded off to 11. Data also shows that Blacks are utilizing more emergency and inpatient settings as opposed to outpatient. What does this say? This says that our white counterparties are receiving more preventative and long-term treatment care as opposed to Blacks who are receiving more of that immediate crisis support. If our adults isn't getting help and support for what they need, then how does that affect our children long-term? We have to really look at that. What are some of the challenges? Of course, stigma within even our own Black community. And then we have to look at research, which shows that Blacks are overly diagnosed with schizophrenia and less often diagnosed with mood disorders such as depression and anxiety. So here I'm coming in the clinic wanting to get help, for my depression, and I may come out with a diagnosis of schizophrenia. So that also, increases the stigma. We also have to look at Blacks are more likely to be incarcerated for mental health as opposed to receiving the mental health services that they need. Insurance disparities is there, and I won't go into numbers because I have other stuff and my time is running out. Lack of representation is also a huge part. Roughly 2% of our clinicians are Black psychologists. That's a low number, despite the increase of Black people graduating in the field. In addition to that, the labor board the United States Bureau of Labor Statistics highlights that the average salary for clinicians is $48,000. A private practice clinician could make at least $100 an hour. Okay. The programs are not embedded in Black communities. They're not embedded in there. So what does that mean? That means that people have to choose taking money to transport them to an outpatient program, or take their money and transport them to their job, which is going to pay their rent and pay food for their children. People shouldn't have to pick, working or treatment. Hours of operation is generally 9 to 5 with limited access to services on the weekends. So again, liquor stores should not be opening up longer and staying open longer than our behavioral health systems. What are some opportunities for us? We can look at how do we embed mental health treatment services in predominantly Black communities. I'm not talking about downtown Rochester. I'm talking about Thurston Avenue, Joseph Avenue, and really put the services in that community. How do we partner with grassroots organizations that are doing the work, but not only partner with them, but put financial behind it, as well as help out with HR operations to support the work that they're doing. Let's look at extending hours to be able to increase services and utilize the telehealth. Let's look at changing different kind of regulations when it comes to state operations and insurances, because that also plays a factor. Let's look at our educational institutions that train clinicians on Western treatment model, and they are not having any kind of partnership with the Association of Black Psychologists, which has been around since 1968 with over 1,000 members. Okay.
Thank you, April. I need to move on, but those are great solutions to some of the issues when it comes to our people finding services in their community and getting there. So those are all great suggestions. I have to turn it back over to Jarrell.
Thank you. Pastor Butler, I'll jump right back in with you and ask, for the faith community, what roles and responsibilities do you feel that they should play in moving beyond what we hear a lot in the Black community, which is cast that demon out or pray it away? What other things can you offer to combat the stigma of mental health through the faith-based community?
Well, I can tell you, I'm gonna do this in 3 minutes too. Watch this. First of all, Kelly got me fired up about that data, because I just did a workshop organizing and interpreting your data with about 17 organizations. And boy, you can hear a pin drop in that room on that Zoom call. Whew, my goodness, she got me on another. I'm just like Zoom. I want to run, especially with all this Black excellence that I'm looking at today. But first of all, that statement about you got a demon, I believe is an intellectual and a spiritual lazy response, first of all. Second of all, what we have to do is begin to train ourselves. I have a little bit of a leg up because when I lived in Connecticut, I went and got some training from Housatonic Community College. So I have a certificate in behavioral health care. So I understand co-occurring disorders. So I have an understanding of the DSM. So for me, I have a little bit of a leg up, but you have to train yourself. You have to get resources. There are some great ministers who are also spiritual counselors that have great information if we're willing to be trained. You have to know you don't know everything, but you have to reach out to what's in the community, what is available. Because one of the books that I actually use for myself is Destroying Mental Illness in the Church, a resource handbook by DeAndrea Bolden, who is a Christian counselor. And so she does an approach called integrated counseling, where you take what you've learned, let me put it this way, secular arena, and you put it with a spiritual piece, and you integrate them together. And I think it's so important to do that, so that we understand the tools that we have in front of us. Also, I have participated locally in Rochester in a workshop entitled "How Can We Help Addressing the Church's Role in Mental Health?" It's facilitated by a local clinician by the name of Deneen Alvarez, a pastor's wife or a bishop's wife. And so what you have to do is tap into what's in the community, train, look to beyond yourself, and understand that mental illness, oh, you got bipolar disorder. Everybody not bipolar. Do you understand what you're talking about? You know, that's another thing. We're just spiritually, intellectually lazy. Do you understand personality disorders? Do you understand eating disorders? Do you understand, anxiety disorders? Do you understand these things that are listed in the DSM-5? Understanding this, then you can connect with a person like William Cannon. You can connect and understand what Dr. April was talking about, and understanding when you know what's in the community, then you can help your people better, because now you've expanded and built on your toolbox so that you can be effective. And the last thing I want to say for William in the community, please reach out to me. It'll be no problem. I have no problem connecting with you. Dr. April, please reach out to me. I'm at the Urban League, right at the Urban League. So please reach out to me as a pastor and as a leader of racial equity. I'll be more than happy to work with you. And again, Kelly, you got me on 100 right now. And I just want to say that. I'm done.
Well, thank you so much. And I think it's clear that you are a leader with a servant's heart. So thank you for that. I'll pass it back to Daphne.
So our next question is for Dr. Lakia Wilson. So social determinants of health and environmental factors are key contributors towards one's health. Address social determinants in the context of systematic racism and how health organizations can examine policies and practices to help our families.
Another loaded question. And I honestly wholeheartedly believe that there needs to be a partnership with our health systems, with our parents, family, and community. We cannot prescribe care acting as if we know what the community needs. We need to listen to the community's voice. We need to have the community review our policies and procedures like, this doesn't work. There are certain things, there are certain roadblocks that are put in our policies that prevent care. You can't even register without a Social Security, driver's license or whatnot, and not all of our families have those. Why do we need that two types of identification to assume care? We need to examine those policies and who are we excluding when we have those policies. We need to look at social determinants of health and understanding that me coming in with a sore throat isn't only related to me smoking. There could be other many factors that are going on. And as a physician, I should not make recommendations without understanding where you come from and what's in your community and what resources are available to you. When I see my patient, it shouldn't be like, what's wrong with you? It should be what happened. What has caused these things? What resources can I put in place? How can I treat you as a family, as an individual, and as a community? So when you're coming and saying these are the things going on, I need to actually look at my patient and say, yes, I want to address your asthma, but I can look at you and your family and say, things are not okay. And I need to take a pause because you may not tell me what's going on, but I can see with my own eyes that there's something going on more than your child's asthma. And then say, how are we doing today? How else can I help you? What is going on in your life outside of the asthma that I could be a part of? How can I help you? What resources can I connect you with? And I think that as a health system, we need to do a better job. Our families and our community needs to hold us accountable. I am also going to go to the extra step that I need to hold my hospital system accountable. When I see injustices, I need to say, wait, why is this happening? Why are you treating this patient like this, but then this patient gets this type of treatment? Why are you even describing that patient to me this way? Do you need those descriptors in order for me to understand my role in their care? So I need to hold my colleagues, my hospital system, the upper management accountable for the systematic racist policies and procedures that we continue to utilize. And then I'll take it one step further, our training. So we have medical students, we have nursing students and whatnot. What are we teaching them? Are we teaching them to look through a cultural sensitive lens? Are we teaching them to treat our patients with stereotypes without not even understanding or getting to know our families? So we need to put the brakes on that. We need to look at our medical education and where we're going wrong. But I can go on, but I want to be respectful of time.
Thank you. I mean, I heard a lot of stuff in there, and it sounds like you're leaning towards an advisory board, maybe a parent and youth advisory board, which would be great to see some of the things that you, to address some of the things you talked about. Thank you. The next question is for Cynthia Adele.
Yes.
Hi again. Cynthia, why is it important that large healthcare institutional partners with faith? Why is it important that large healthcare institutions partner with faith-based and grassroots groups when it comes to addressing mental health in the Black community?
It kind of goes back to the first person's expression. They said, how can you serve me if you can't see me? So it's important that they partner with faith-based and grassroots groups because there's still a lot of distrust regarding care institutions and whether they have the best intentions for the African American patients. Are we being given the same care and treatment as their other patients? There has been a history of using African Americans for studies and trials that we weren't aware of. Many feel as though their concerns are not listened to or acknowledged by their care providers. We are not as apt to listen to their message as we are of faith-based and grassroots groups. Faith-based and grassroots groups serves as a spokesperson or ambassador to the community that the organizations want to reach. It is especially important because mental health is such a sensitive topic in the African American community. People want to identify with people that are delivering the message. That means they want the person to look like them, have shared some of the same experiences as them. If you're overweight and someone gives you a treatment plan, you don't want that person to have never experienced having a problem with weight. If your life or your loved one's life has been affected by mental health, you want to hear from someone that has dealt with that and that they can share real life experiences with you. Someone who is going to speak your language and keep it real with you. The church roots and grassroots are for the most part located in the community in which we live. So they're trusted in our communities. As you know, some people will listen to their church leadership before they'll ever listen to a doctor. If that pastor says it's okay for you to take your medication or go see a therapist for your mental health, anxiety, depression, more than likely the congregation is going to feel that it's okay and it empowers them to make that appointment. So there is so much respect given to our church leadership and the grassroots workers. So it serves the care institutions well that they do start to partner with those entities. And I see that they have, and it's been a very smart move for them.
Thank you. I'm going to pass this back to Jarrell.
Yes, so we're going to shoot it right back to Mr. Cannon. And this one is real close to me, my heart. So it's saying we're seeing a lot more negative statistics regarding Black males. And very few programs intentionally put together to address their mental health concerns. What can we do to engage at the grassroots level and discuss the priorities as it pertains to system level changes?
Thank you, Drew. Once again, great question. One thing that I've encountered is that Black men sometimes have oftentimes have a mistrust of the healthcare system, and particularly the mental health care system, because they feel their values and concerns are really not being heard. Black males, have an even greater need to be able to relate and be understood by those who they're trusting with their mental health treatment. This is due in part to historical, but also current systemic racial barriers and challenges that Black men specifically face. So what this does is it prevents Black men from ever engaging in mental health treatment. And then some who are engaged, will often disengage and never re-engage, which creates a, obvious problem. An example of this, kind of occurred in 2020 when the George Floyd incident occurred and the subsequent, racial unrest, attached to it. A lot of Black men expressed that it was very challenging or impossible at times to continue engagement with mental health treatment providers who are not African American. That was kind of subsided a little bit, but it was very, very, more intense and intentional in 2021, going into 2020, going into 21. So this is not to say that non-African American, mental health providers were any level less qualified, but the fact is that once a person feels, devalued by a segment of the population, it can be very difficult to take something, something as vital, personal, vulnerable as one's mental health and entrust it to someone in whom they don't trust. Also, another point is that many African American men, they meet me, and number one, they're shocked, to see me in this position. As I said, I'm one of 22, at my department. So they see me and they're shocked, to see me. And number two, they open up to me very quickly with some of their deeper concerns, many times, about racial concerns and systematic concerns, economic concerns, things like that, before they even had a time to get to know me as a therapist. But, they see me, I look like them, and it's an automatic relational, aspect. So one thing needs to happen is continued recruitment of African-American male clinicians in the field. There also needs to be more intentional leadership development opportunities for African-American males who are already in the field. Over my 15 years here in the field, I've often seen leadership teams be very intentional on seeking out and developing Caucasian therapists for leadership, but the same is not done for us. There also needs to be more choices in regard to where African-American men can seek treatment, mental health treatment. For example, if you're a person of low income, there are limited choices in seeking mental health treatment. One's income should not be the sole determining factor in the choices that one has in seeking out quality mental health treatment. Black men often don't have access to mental health treatment, as many low-paying jobs that they're working. They offer insurance, but the insurance is so high that it's impossible to obtain this insurance, and with that insurance, use it for mental health treatment. There also needs to be more funding targeted and earmarked specifically to meet the needs of African American men. A lot of the violence that we see in our streets, sure, it's socioeconomic based, but make no mistake about it, an area that does not get enough attention is the correlation between the mental health and much of the violence that we see in the city I live in Rochester, New York, and around this country. And finally, at other times, it comes down to a simple lack of education knowledge about how to access resources that are out there free of charge or at a significantly reduced rate, specifically for mental health purposes. Medicaid, even having, being aware and, navigating the Medicaid eligibility. Affordable Care Act subsidies, EAP through many employers, and colleges also will often offer free or low-cost counseling at a reduced or free rate.
Thank you so much. So clearly you're immersed in this work. So thank you for what it is that you do. I'll pass it back to Daphne.
So the next question is for Kelly. Kelly, having staff who reflect the populations you serve is critical, and you have been intentional about the diversity of your team at all levels. How can we develop intentional career pipelines for more clinicians of color, peer and family advocates, and administrators?
Thank you, Daphne. I really think as I was listening to that question, it comes down to, I was reading this article and something that the guy said really resonated with me. It was this, it's an article about Black CEOs and chief level positions. And they really were just talking about the challenges and that glass window and getting through. And one thing he said in there was, I could have all the education, the experience, the degrees, but until someone made space for me, I couldn't get in. And so when we talk about having staff who are reflective of the populations, to me, it all comes back to, we have to make space. And now people talking about if you can't see me, so I can come to we're out here, we have clinicians out here. William talked about, he went on those interviews and his white counterparts were chosen over him. So you have to look at, how can I make space and understand, and you don't even think about making space if you don't truly value having diverse perspectives. So you first have to understand we need diversity. How am I going to make space for diversity? Who's screening? Who's screening out candidates? What does that process look like? Who's doing these interviews? The best way to compensate for that is to set up some kind of panel screening where you have diversity sitting there. So when people show up from different backgrounds, your unconscious biases don't show up and keep them from getting in the door. So we have to make space for people to come into these positions and jobs. And when you realize that that diversity is going to lead to better engagement of clients and satisfaction, you're going to want it. So once we want these diverse staff at these positions, will make room. And so that's some of what another piece, last I'll say, that we've done, that we're doing. I like to, we have high school students that are coming in. I think it's important for some people don't get to see other Black and brown successful individuals working in different capacities. So we're hosting some high school students. And you should look at marginalized areas where you can invite them in for an opportunity. I want them to come in and see me in my office. I want to meet with them and talk to them about this field. We need Black and brown people. So as you think about going to school, think about this field. It's not just the field where you just can't survive. There's opportunity in here. So think about going into a career of behavioral health. And there's a lot of things that you can do in that, whether that's nursing, counseling, administrative, all of that. So I think in making space, there's a lot of things under there that can be done. And I'll leave it at that because I know we're short on time. Thank you.
Thank you. And last week we heard that OMH is committing like $10,000 to bring clinicians of color to help them with their schooling. So we did hear that last week. Thank you. I'm going to turn it back over to Jarrell or possibly Sarah.
We have Dr. Aycock's question, Daphne. Or Jarrell.
Oh, okay. So April.
As well as Kelvin's second question, so.
Okay, so Jarrell, go ahead.
Yep, sorry about that. Mr. Eaton, so as a professor, not-for-profit executive leading anti-racist education, and we know that mental health in the Black community has never been made a priority. What can we do to change that and advance this work and opportunities for healing across different systems?
Yeah, well, we really have to fund the people and the groups doing the work. We have no shortage of clinicians and providers who are rooted in our communities, who are working with systems, but also who are on the front lines. Dan Butler and William here as well. So we really have to, from a policy perspective, make sure that we're funding the organizations and groups that are doing this work, that are engaging and having conversations with those most marginalized in the Black community and other communities. And we have to just continue to provide education as well. We have to be comfortable and willing to call out the harm that's done by our hospital systems, many across Western New York and New York State. We have to be willing to listen to the voices of those who are marginalized in our communities. And I think someone shared earlier, really listening to what community members are saying that they need from providers as it relates to the interdisciplinary nature of mental, social, and emotional health. And we have to continue to educate ourselves. And I'll just, in my final words here, promote a book that speaks on a lot of this, right? The Unapologetic Guide to Black Mental Health by Dr. Rita Walker is a great resource, both for clinicians and for community members who are really wanting to understand how to navigate the very complex hospital systems and cultural institutions in which they need to connect with in order to receive services. So education, funding, right, and making sure that we're making these connections and really listening to the voice of those who are most impacted by poverty and structural racism.
Thank you so much.
So Dr. April Aycock, I have one more question for you. And the question is, talk about provider accountability, moving beyond the check the box performative process to operating from the lens of racial equity. And then I wanted to add something else onto that. How is it that you know that the programming that is supported in the community is actually helping the people who are receiving the service?
Can you hear me? Okay, so I am going to be cognitive of my time and try to answer these questions. I would say that the first question, Kelly did a great job with really highlighting organizations' accountability and different processes to set that up. So I won't go fully into details with that because that would be kind of redundant. However, I want to look at the accountability on a system level. One of the things I would say is that we need to attend and participate in public comment sessions that's going on a state level. And so they ask for feedback, they want feedback, participate in that, especially when it comes to different behavioral practices and regulations that may be changing. The other thing I would say is, again, talk to your officials, your political officials to say, let's look at the behavioral health operational regulations. These regulations is what is required for organizations to operate their facility. So look within those and see what kind of accountabilities can be held there. Also look at insurance policies and companies as well. That is where you're going to get some of that systemic change that may be able to come. The other thing I would say is vote, and follow your local, state, and federal politicians, and not only vote in the general election, but also look at the midterm elections as well. And I would also say invest in lobbyists, which is something that is extremely important as well. So I don't know if I have enough time, but how do we know that our organizations are locally or even outside of Monroe County is doing the work? A lot of times you look at the outcomes for some populations. And then you also look at a lot of the organizations have state accrediting bodies that are auditing the organization. So they're looking through charts. They're looking, they're interviewing sometimes clients as well as staff. And I won't go too much, deep in the weeds to that question. So did I make my time? Because I got cut off last time. So I'll make sure I make my time.
Yeah, I apologize. But yes, you did answer the question. And what you said was very helpful to people who really want to know about how is programming overseen. I'm going to turn it back over to Sarah now.
Wow. All I can say is wow. And thank you. I know we were not able to get to the questions in the chat, but I promise you that we will post them on our website, bipopparentvoice.org. I will send these questions out. Our tech team are cutting and pasting them as we speak, and we will make sure that we honor those of you that posted some of the questions, that we will honor your presence here today and some of the information that you've asked. I can't thank you enough. Our expert speakers, you have been amazing. Just for you saying yes, your talent, your expertise, your level of influence in the space that you're in is making a difference. And I can tell you personally, all of you from all over this region have had an impact in my life and many of the families that we work with. So again, thank you to all of our sponsors, all of our attendees, all of our parents that were here, and caregivers that were here to get information, all of our faith leaders, all of our providers that have admitted we're missing something. We do have some gaps. We do have systemic issues within our organization. So thank you for providers, because often providers may get on the defense, but the fact that you're here listening and wanting to grow in the space of racial equity, wanting to work alongside us as we work toward healing in the Black community and meeting them where they are. We are going to continue to talk about mental health in the Black community next week. We invite you to join us and invite someone in this safe space and safe place where we don't just want to talk about the problems. As you heard today, some concrete strategies to move our communities forward. I say it over and over as a parent advocate, this is not about outcomes, this is about saving lives. So until next week, thank you. Please complete the survey. We'll post more information. This video will be on our Facebook page. Our videos will be there. And again, we're going to open the chat for a moment. If you want to say something to the speakers, we are open it. We asked you to refrain from selling in the chat, but we did put the speakers' information for you to reach out to. So have a wonderful day. I know our tech team will put the slide up and continue to play our slideshow, and thank all of our sponsors and partners, and particularly our expert speakers who shared so much resource information for us to leave away from, going back to our organizations, going back to our communities, going back to our homes, or going back to our families to say, let's talk about mental health in the Black community. Have a wonderful, wonderful rest of your day.
Thank you, Sarah.
Bye, everybody.
Bye.
Hey, Sarah, so I can do this survey. This is being up for me to do the survey right now.